Hello everyone. Last class we discussed about the properties of laser, which were monochromaticity, coherence and collimation. We also discussed about the production of laser, where we discussed about ruby laser, helium neon gas laser and diode laser. So here we'll discuss about the classification of lasers and their physiological effects. So laser is classified, the low level laser is classified based on wavelength. The first classification is visible red laser. The wavelength of this type of laser is 630 nanometer to 660 nanometer. Visible red laser is extensively used for treating wound healing and treating superficial pain and inflammations. This type of laser cannot penetrate more than 1 centimeter. You can see in the second uh, picture here, this is the visible red laser where it is penetrating only 1 centimeter depth and its wavelength is 630 nanometer to 660 nanometer. The second type of laser according to its wavelength is infrared laser. Its wavelength is 780 nanometer to 904 nanometer. The infrared laser can penetrate deep inside tissues and are hence used extensively for treating deep-seated pain. You can see that it is penetrating about 5 centimeter in depth, so it can be used for treating deep-seated pains. Now, laser also can be classified based on type of applicator mode. So, the first type of applicator is called as scanner based laser. You can see in the picture here, it's giving a scanning based laser on the posterior aspect of the neck. The scanning based laser is the best method of treating all types of wounds, burns, and superficial pains such as low back pain. Next type of laser is called as probe based laser. So laser radiated through a pen like handle is called probe based laser or spot laser. This type of laser is generally used to treat smaller surface areas or trigger points. So the trigger points, for example, in this picture, this probe based laser is used to treat the medial epicondyle inflammation. This is the scanner based laser, and this one is the probe based laser which we have in our department. Now moving on to physiological effect of laser. So main physiological effect of laser is biostimulation, that is it stimulates the tissue for regeneration. So what is biostimulation? When the low energy of laser light of specific wavelength, that is 635 to 904 nanometer, is irradiated on the body, the energy is observed by the cells in the local area. This process is called as biostimulation. So what are the effects of biostimulation? Biostimulation in turn affects cell membrane permeability, therefore promote healing. So we can see here, for promoting healing there should be increase in cell mobility, which will be enhanced by the low level laser therapy. There will be activation of phagocytes which enhance phagocytosis. There will be increased cellular metabolism. If there is more metabolism, that means there is more energy production and therefore there will be enhancement in cell proliferation. There will be stimulation of immune responses, the stimulation of macrophages where it will accelerate phagocytosis. There will be activation and proliferation of fibroblasts which will strengthen the tensile strength of the tissues. There will be stimulation of angiogenesis. Angiogenesis means a new blood vessel formations. Prostaglandin productions will be increased, which will enhance vasodilatation. So once there is vasodilatation, there will be more blood flow. So angiogenesis combined with vasodilatation will increase supply of blood to the local area where there is tissue damage. So this too will enhance tissue healing by increasing blood supply, nutrition and oxygen. The biostimulation will counter apoptosis. Apoptosis means the death of cell. So these are some of the effects of biostimulation in tissue healing. What are the indications for laser? Indolent wounds. So the lasers are mostly used for indolent wounds. Indolent wound means the wounds which resist to heal or it is difficult to heal. For example, severe bacterial infection or the areas where the blood supply is compromised. So this type of wounds can be healed by laser. We also can use laser for pressure ulcers, that is because of prolonged immobilization the tissues will be compressed on the hard surfaces or on the bony prominences which will cause ulcer formation. It also can be used for diabetic ulcers, venous ulcers, burns, surgical repair, wounds or skin grafts. These are some of the important indications for laser. Some other indications are rheumatoid arthritis. It will enhance tissue healing of the eroded tissues here. This is the knee joint or any other joint where there is an erosion of tissues around the joint which is caused by rheumatoid arthritis. It also can be used for osteoarthritis to reduce pain and enhance tissue growth of the eroded cartilages or tissues around the joints. It can be used for bursitis, that is inflammation of bursa, plantar fasciitis, low back pain with muscle spasm, tendinitis, that is inflammation of tendons such as tennis elbow, golfer's elbow, or supraspinatus tendinitis. It also can be used for myofascial trigger points, that is the nodule formations in the muscles because of overuse of the muscles or lack of use of the muscles. There will be trigger formation, that is nodules will be formed in the muscles which trigger the pain. So those kind of conditions are called as myofascial trigger points, which also can be improved by laser therapy. Other indication is carpal tunnel syndrome, where the median nerve will be compressed inside the carpal tunnel. Now coming on to therapeutic effects. So it is the process of biostimulation. The first therapeutic effect is to reduce healing time. So if the wound would heal by 2 weeks, if we apply laser, it will heal sooner than 2 weeks. So that is called as reduce healing time. Because of the laser therapy, there will be biostimulation which will increase macrophage activity. If there is increase in macrophage activity, there will be fibroblast proliferation. When the fibroblast starts to proliferate, it helps in cell regeneration, which will increase tensile strength of the tissue and therefore accelerate wound healing by formation of granulation tissue. And if it accelerates wound healing, then the time for healing will reduce. Next therapeutic effect is pain control. So the biostimulation effect of the laser will change the cell membrane. So there will be more cellular mobility, which will increase endorphin, which is responsible for reduction in pain by pain gate mechanism. The third therapeutic effect is the inflammation reduction. Because of the low level laser therapy, there will be biostimulation and there will be increased cell membrane permeability, which will enhance calcium, sodium, and potassium migrations through the cell membrane. There will be increased leukocytes activities and enhanced lymphocytes response. These white blood cells will reduce inflammation by improving the immune system of the cells or the tissues. So these are the three main therapeutic effects of laser therapy. Now, what are the dangers and precautions that we need to take while applying laser therapy? Laser can cause damage to the eye, so therefore, while applying laser, we have to be careful that the laser beam doesn't enter the eye. So, laser into the eye or looking directly into the beam should be strictly avoided. So, we have to use protective goggles while applying laser. The patient also has to be given a protective goggles, and the therapist also has to wear the protective goggles. So, the precautions are avoiding laser beam reflection from the shiny surfaces. We have to switch on the machine only after the applicator is in contact with the skin, and we have to use protective goggles. The main contraindications for laser are neoplastic tissue, that is abnormal growth of the tissue, which are cancer malignant cells. The laser causes proliferation. We already know from biostimulation that laser causes biostimulation, which will enhance metabolism. So if the tissue is already malignant or neoplastic, metabolism is going to increase the tissue growth. Therefore, if there is already the presence of cancer or tumor, there will be even more growth in the cancer cells or tumor. We have to be careful while applying, so that we should protect the pregnant uterus, and we cannot use laser therapy if the blood vessels are open and there is hemorrhage, and if there is a hemophilia, then we cannot use laser because it causes vasodilatation, and direct contact with the infected tissue has to be prevented. Let us go through it again. The classification of low level laser based on wavelength are visible red laser, which has a wavelength of 630 nanometer to 660 nanometer, and it can penetrate only up to 1 centimeter, so it can be used for superficial tissue healing. Second type of laser according to its wavelength is infrared laser. It has the wavelength of 780 nanometer to 904 nanometer. It can penetrate to the depth of 5 centimeter and therefore can be used for deep tissue healing. Classified based on types of applicator mode. They are scanner based laser, which can be used mostly for large tissues, and probe based laser, which are used for small areas such as trigger points, tendinitis such as golfer's elbow or tennis elbow, that is medial epicondylitis. These are some of the machines which we have in our department. Then we discussed about the physiological effect. The main physiological effect is the biostimulation. The biostimulation will enhance the tissue mobility, activation of phagocytes, increase cellular metabolism, cell proliferation, stimulation of the immune responses, stimulation of macrophage, activation and proliferation of fibroblasts, stimulation of angiogenesis, and production of prostaglandins. Therefore, this will counter the death of cells, enhancing tissue growth. The main indication of laser is wounds. For example, pressure ulcer, indolent wounds, diabetic ulcer, etc. Other indications are rheumatoid arthritis, osteoarthritis, bursitis, plantar fasciitis, low back pain, tendinitis, myofascial trigger point, and carpal tunnel syndrome. The main therapeutic effects of laser therapy are reduce healing time, pain control, and reduction of inflammation. This all are achieved because of the biostimulation.